Our next presenter is Ms. Albani Dotson.
Hello everyone, I'm Albani Dotson and my career choice is Pediatric Oncology Nursing. Pediatric Oncology nurses take care of children with cancer, so it ranges from the age of babies to about 18 years old is who they take care of. They administer and do treatments such as radiation, chemotherapy, and things like that. They help the patients recover from their surgeries, and they also help the children and their families cope with the disease process. Necessary qualities you will need to be an oncology nurse would be patience. You need to be empathetic, compassionate, emotionally strong, make good decisions, calm and professional, excellent communication skills, and have critical thinking and problem solving. Why I chose this career, I've always been kind of led down the medical field, but recently I just decided I really wanted to work with small children and their families that have cancer, and so it's going to be difficult, but I think it'll be worth it. To get this degree, you need an associate's degree, which is 2 years, or a bachelor's degree, which is 4. I plan on going for my bachelor's because I'll have better opportunities with that and make more money doing so, and I'm going to go to the University of Tennessee at Chattanooga. The average pay ranges based on experience and things like that. So for entry level, it's about $57,000 a year. Mid-level, $72,000, and senior level would be $97,000. It also ranges on states, so different states make different. In Tennessee, the average is about $55,000, Georgia is $64,000, and North Carolina is $57,000. And here's a little map. The darker areas are going to be your areas with more money, so such as California, they're highly populated, so they'll be making more money, and so on like that. The benefits, like many other medical jobs, you get health insurance, dental, 401k, some sign-on bonuses because it's really needed right now, and many other different ones, but these were kind of the main ones that they had. Places you could work, Vanderbilt Children's Hospital, which is in Nashville, is a really good hospital I'd like to look into, but there's other ones. There's one in Chattanooga and just all over, but you have to go towards a bigger city to make really any money. So my budget chart, I'm working a part-time job currently, so I'm not making a whole lot. I'm making about $300 to $400 a month. Controllable spending comes out to about $800, and my fixed spending is about $1,000. So my balance was a little down, is negative $1,825. How does my career portfolio help? I do have my CNA certification, so that's in there, and they'll like that because it's medical. My resume, my letters of recommendation and reference, and my transcripts. Does anyone have any questions?
Do you need an internship for that?
You do not need an internship, but because I have my CNA, I plan to apply at TC Thompson and see if they'll let me work under a nurse there, so I will be able to have more experience in on-job training.
If you became a nurse and didn't want to do pediatric oncology, what other specialty would you go into?
I'd really like to do the emergency room, and since that's a specialty, I'll probably be able to start in the emergency room and maybe work my way up to pediatric oncology.
So what specifically stood out to you about oncology?
Just I really love little kids. I've always had a heart for kids. I used to help at my church with the children's ministry, and so I still do that a little bit here and there, and so I just really love doing that and want to help out as much as I can, and so it's a really hard career choice.
I think it would be really hard dealing with sick children.
Yeah, definitely.
And being able to handle that, but as we know often, we need to do that.
I think it'll be worth it for sure.
Yes. Are you planning on staying on campus or commuting back home?
At UTC for freshmen, you are required to live there the first year, but after that, I haven't really decided. Probably decide next year what I like. Not too sure.
Did you say what was your backup plan in case this?
If I do get my nursing, I'd like to work in the emergency room if that doesn't work out, but if not, I have my CNA already, and I'm working on my pharmacy tech, so I'd like to do something with one of those if it doesn't work out. And hopefully this summer, I'll be able to work as one of those. I'm already working at Kim's Pharmacy right now, so working on that.